We're joined this morning by Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. Each of our speakers will share an update, and after their comments, we will take questions using the chat feature. Please make sure to put your questions in the chat to everyone so that all of our speakers can see. With that, I will turn it over to Executive Summers.
Thank you, Heather, and good morning, everybody. Good to see you all. I just wanted to take a minute to say a quick word about the Martin Luther King Jr. holiday. For those of us who serve in the public, yesterday was really just another important reminder that our efforts to combat racism and bias should never end, and we need to be thoughtful of them at all times. Black Americans have had to face hate, violence, and oppression. This has had lasting consequences for individuals and families across our country and in our county. So I know at Snohomish County, we've worked really hard to ensure our response to COVID-19, including the distribution of vaccines, access to appointments, testing, etc., has been informed by community-based organizations and individuals from a lot of historically marginalized groups. So we're really committed to seeing both our response and recovery reaching everyone in our community. We can't afford to leave anybody behind, and it's been particularly evident during the pandemic that there are many communities throughout the county that have difficulty of access getting to vaccines, getting appointments, having computer equipment. So those disparities within our community have become very, very evident, and we've been mindful of them and have worked really hard and will continue to work really hard to make sure everybody has access to the healthcare and COVID response that they need, everybody equally in our county. So really, whether it's racism, bigotry, or anti-Semitism, our entire community is really diminished when hate succeeds. So it's important for us to double down on our efforts. I also like to take this opportunity to let the Tongan members of our community know we're thinking of them and hoping for a quick recovery from this weekend's eruption. I know you've seen the pictures, just amazing and a lot of devastation, but I'm heartened that early reports anyway are that death and injuries have been fewer than expected, but there's still very difficult communications to that part of the world. So we'll keep eye and we offer any help and assistance and comfort we can to families and in any way we can. So with that, I'll hand it over to Dr. Spitters. Thank you.
All right, thank you, Executive Summers, and good morning, everyone. Provisional updated weekly COVID case counts and 2-week rates show a slight decline in the case counts for last week versus the week before, coming down from a peak of 13,000 to about 12,000 from 2 weeks ago to last week. Due to the high number of cases and the 14-day window still having a large number, that still rose up to 3,000 per 100,000 for the 2-week period ending Saturday. But this is consistent with informal reports from community-based healthcare providers, also suggesting that last week's numbers were down a bit from the previous week, and is in sync with projections from the University of Washington's Institute for Health Metrics and Evaluation, predicting, if you will, that last week or such was our peak in infections. Hospitalizations, however, continue to rise, with now 222 beds in Snohomish County hospitals. That's about 30% of all beds available filled with COVID patients. This is almost double the prior peak, which was down around 110 to 120. As of this morning, there is only 1 intensive care unit bed and 26 regular care beds available in Snohomish County hospitals, so occupancy is virtually 100%. We continue to urge people to use the emergency room only for true medical emergencies. Please don't go there if you have just a mild respiratory illness and want to get a COVID test. Please find another venue in your personal healthcare system or one of the many test sites you can find through a test site locator. On the other hand, if you do have an emergency, difficulty breathing, chest pain, an accident, an injury, severe abdominal pain, symptoms of a stroke, things like that, do not delay going to the emergency room because of this. Disturbingly, and despite what appears to have been a crest in the infection rate, this situation with the healthcare system is likely to get worse before it gets better. The peak in hospitalizations generally lags behind the peak in infections by about 2 weeks. So even though we've seen a leveling off or a slight downturn in reported infections, it is expected that hospitalizations will continue to increase through the first. On that list, everything from vaccinating, getting your booster, continuing to wear masks in public, trying to wear the highest quality mask you can get your hands on, avoiding crowds, and keeping indoor spaces well ventilated. Last week, Governor Inslee announced deployment of non-clinical National Guard personnel to several hospitals in the state, including Providence Regional Medical Center right here in Everett, to assist with the emergency department surge. These staff are expected to work at Providence, start work at Providence later this week or early next week, and again, help with non-clinical tasks in patient management in the emergency department. I'm glad to see this additional resource arriving here in Snohomish County, and the good news is that more is on the way. Last week, we announced a new vaccine site being opened in partnership with the Washington State Department of Health and the Washington State Emergency Management Division. It is opening this morning in the Everett Mall. For the next few weeks, it will operate from 11:30 a.m. to 6:30 p.m. Tuesday through Saturday, and 11:30 a.m. to 5:30 p.m. on Sundays. This site will offer all vaccines for those 5 and up. So first dose, second dose, boosters, you name it. Appointments are required, and people can register for a vaccination time at www.snohd.org/Everett Mall Vax, VAX at the end, all one word, no spaces. If you can't find that, then just go to our website, find the vaccination page, and there should be a link to it off of that. We're also working with the county, state, and federal emergency management agency to get a mass testing site opened here in the county soon. We're finalizing the operational details and working to get appointment slots loaded, so we hope to have more to share in the coming days on that. In addition to that site, we're anticipating that our orders of at-home tests to be arriving at the end of the month. Initial priority is for schools and long-term care facilities, but we'll provide more information on those test kits and how the community can access them as time passes here. These resources couldn't be coming to Snohomish County at a better time, and we are most appreciative of all the partnerships that have helped to make them happen. This added capacity for testing and vaccines, while it won't immediately curb the healthcare crisis that is currently underway, it will diminish future cases and prevent another surge, we hope. It will also help those who are desperately searching for vaccination or testing appointments get that need met, as well as helping to relieve some of the pressure off the broader healthcare system. So with that, I'll turn it back to Executive Summers for questions.
Thank you, Doctor. Any questions? All right, here we go. There's a small percentage of people in Snohomish, King, and Pierce counties that are absolutely dead set against getting the vaccine. What is the impact this small group of people has on the rest of us?
Well, in Snohomish County, about almost 75%, and this is very similar numbers statewide, about almost 75% have initiated vaccination, and it's about 67 or 68% that have completed it. Of those who have completed it, almost half of those now have gotten a booster. So we're certainly continue to make progress, but yes, there are there is a subset. I don't think it's all of those remaining 30%. Some are not eligible because they're young kids. Others have some medical or religious exemptions, but there is certainly a group that are a hard no on getting vaccinated. And, while we, always, the door is always open if anyone changes their mind, efforts to push probably aren't going to help those folks, help us. The higher vaccination coverage we have, the better. On the other hand, we all have measures that we can take to protect ourselves, regardless of what others are doing. That's, ourselves, you yourself, making sure you're fully up to date with all the COVID vaccines that you're eligible for, getting the flu shot, wearing a mask, avoiding gatherings, keeping things ventilated. Would it be better if everyone were, if we had 100% coverage? By all means. But if you compare it to annual influenza coverage, we are doing a lot better than that, which, the flu shot, generally 50 to 60% coverage is a good year. So in comparison to that, we're doing a lot better. On the other hand, the COVID crisis is a little bit more of a urgent problem than the annual influenza surge. So, it is what it is. Even though folks who are a hard no on vaccination, the door is open. And although they, have a variety of legitimate, understandable concerns, either about liberty, possibility, concern about safety. I think overall these are safe and effective vaccines. And while we want to acknowledge people's concerns, even though that's legitimate, there's, we're in a crisis, and that's why measures like this are necessary. And we'll continue to promote it and make it available. But there's no, have no vision of a vaccine mandate for the general population at this time.
All right. Next question is, what effect will at-home testing have on our case numbers? Will there be positive cases that slip through the cracks because at-home tests require honesty in reporting?
There we go. Certainly, while there's a mechanism set up for people who test positive at home to call 211 and get connected to a local health jurisdiction for follow-up, in reality right now, the number of cases is far outstripping the capacity to do that. So, although there's some loss of counting cases when that occurs, if people test at home and don't call in, right now, the key thing is for people who are infected to become aware of it and to isolate themselves, notify their close contacts, and if they're not fully vaccinated, have them quarantined. And that benefit far exceeds any loss to counting, and in the short run. And, in the long run, in perpetuity, right? We're going to have to transition more to the model we have probably for influenza in the very long run, which is common sense, prevention measures, masking, distancing, vaccinating when things are bad, but focusing less on catching every single case, because the system doesn't have the capacity to do that. But I think people do have the ability to take those actions to protect themselves and others around them. And home testing is a big step in that direction, and we're very supportive of it.
All right. Is there a sense that the county and state's efforts to increase testing capacity is coming too late in this surge? And I'll say a few words when you're done.
Yeah. Well, it would be nice if we could, just flip the light switch on or off, or had a dimmer switch to make these kind of resources available, and would have been more helpful earlier. But we're still at the peak of a transmission wave, and testing helps bend the curve when you're on the way up and keep it going down when you're on the way down. So it's not too late at all. And testing, vaccination, testing has short-term benefits that we need right now, even though we're at the peak, and vaccination has long-term benefits. So I'm sure it would have been nice to be able to flip the switch earlier, but given the circumstances, these are welcome resources and we're grateful.
Yeah, I just add that we've been at this for 2 years now and had multiple waves. I'm starting to lose count, but it's always a challenge standing up capacity. And then as we go down from a peak, you can't have people and resources sitting around doing nothing. And so you sort of stand down without knowing what's coming next. So yeah, there always is a little bit of a lag from the surges, but that testing capacity is still vitally important to getting us back on our feet and getting businesses thriving again. So it's not too late, but I'm hopeful actually that this is the last surge. I would love to be at the tail end of the last surge. That would be wonderful news. But we'll continue to respond as new events come forward, and just try to be as ready as we can and help people as much as we can. But there is an inevitable lag, and because we cannot predict, nobody could have. I didn't hear anybody predict what Omicron was going to do. So it is what it is. And we are building our capacity. We've stood up mass testing sites before. The fairgrounds was one of those places where we had mass testing and mass vaccinations that were very popular and crowded at first, and then demand dropped off, and we have to respond to that too. All right. Is the advice about getting COVID tests still to give priority to people with symptoms? What should people who need proof of a negative test do if needed for work or school?
Well, in the grand scheme of things, certainly people whose medical management, particularly people in an emergency room or on their way into the hospital because they're severely ill, those are folks for whom the test is of greatest importance, because it's going to affect their management. If it's negative, the clinicians need to start looking for something else, whatever else it is that's making them ill, and then go from there. And if it's positive, then things go down that road. So the top priority by all means. And then, disease control benefits from testing close contacts, particularly in settings where transmission is ongoing and you're trying to interrupt it, like long-term care facilities, homeless shelters, things like that. Other close contacts would be the next priority. And then there's all this variety of administrative testing for employment and travel and that sort of thing. So when I delineate these priorities, I'm not diminishing the social need for individuals who have administrative testing requirements to get that test. And hopefully these resources come into the county will take up some of the slack that's been in the system, and people haven't been able to get tested. So I'd say if your employer's requiring it but not providing it, then keep trying through the existing system, and you should see greater availability, both as demand declines in the coming weeks with decreased incidence of disease, but also with the increased testing capacity that's coming up, as well as the home test kits. Stay tuned on that about how to access those.
If there's only one ICU bed open in the county, but hospitalizations are expected to increase, what do you expect hospitals will have to do in order to address these additional people?
Yeah. Well, first, I mentioned that one ICU bed because that kind of highlights the serious and precarious nature of the healthcare system and what it's been in the last couple of weeks, and is likely to be for several weeks more. Now that can change even in a day. 5 people move from the ICU out to the general medical floor, and now you've got 6 beds. So that's one thing. But also, just looking forward, there's a variety of things conceptually that healthcare systems can do. It's kind of out of my lane to know or to say what's best in a particular situation, but one is to try to increase space capacity. Providence has been very innovative in trying to, throughout the course of the pandemic, trying to repurpose other areas of the hospital. And I know the other hospitals are trying to do that sort of thing, using other like procedure rooms. Procedures aren't happening right now, so they can use those to expand care space. Staffing is the real challenge right now, and so to care for more patients with this with a fixed staffing, which is kind of what everybody's got right now, you kind of have to move into contingency or crisis type staffing, where normal patient to staff, patient to nurse ratios are stretched greater in order to do the most good for the greatest number of people. But there's no free lunch. So, if we have to let more people in the hospital, there's going to be a change in staff to patient ratios. Also, throughout the state, I think there's more like 50 or 60 ICU beds. So somebody who's in Snohomish County who needs to be transferred to an ICU bed and it's not available in the county, there's a system, the Disaster Medical Coordination Center, that matches people needing beds with a bed. It's just not always going to be in their community. But your question raises the point, do we reach a point where there's just no beds left? And with 2 weeks to go, I hope that's not the case, but it's conceivable. And then at that point, it's something to be managed between the healthcare system and the state about moving towards standards of care that are adjusted to account for the incredible surge. And so you have to, and again, at that point, do the most and the best you can for the greatest number of people, but it's not routine operations by any stretch.
I'd like to go back to an earlier question and make a comment. It was a question about the folks that are dead set about getting the vaccine and what the impact is on the rest of us. And, having just had COVID over the Christmas holiday season, both my wife and I really drove home how we are affected by others around us. I don't know with 100% certainty, but I'm pretty sure we got it from a person who was unmasked. I don't know whether they were vaccinated or not, but you have to get COVID from somebody else. And so you could be wearing a mask, which we were, and if the other person isn't, that cuts down on the protection, increases your risk. If the other person is not vaccinated, it's been shown that they tend to shed more and for a longer period of time. So again, it's increasing risk to others around them. It's just all the sort of safety things we have. It's not just about our own individual health. The vaccine, yes, I'm very glad I got my vaccinations and boosters. It probably meant that I had a very mild case, helped with that. But it also protects others around me and vice versa. So, and the last thing is it's been shown that unvaccinated population among us serves as a pool for transmission and also potentially for new variants coming out of the virus. And so there's a number of negatives to it. It's not their own individual health, it's those around them, and especially risk to folks who are really susceptible, whether it's age or other illness, or just think cancer treatment, for example, drives down your immune system. So there's a lot of people out in our population that are more vulnerable, and they're put at risk by people that are not vaccinated, who will not wear masks and who will not socially distance. Let's see. You feel like a lack of available testing is an environment that fosters the appearance of testing sites like this basically phony testing company that recently shut down?
Well, this is a non-medical opinion, but when there's a crisis, sometimes people will move in to exploit that crisis at the expense of others. You know, I'm not intimately familiar with the details there, but I know there's concern about what was going on, and I'm glad that the state jumped in to address it. But yeah, I think, you know, any crisis creates a venue for bad actors to jump in and exploit others.
Yeah, I'd say it's more the crisis itself rather than the lack of available testing. We certainly had a crunch over the holiday season in testing both demand and availability. But these organizations were set up before that, and they were just apparently, and I don't know the details either, taking advantage of people's situation in the COVID. So pretty disappointing, not too surprising.
All right, this is Heather in the Joint Information Center. Looks like that's all the questions we've received in the chat box, so we'll go ahead and wrap up. Thank you all for joining us, and please stay tuned for future media availabilities. Thanks.